Hello, everyone. My name is Daryl Gordon, and I'm Vice President of Marketing at MediKeeper. Thank you for joining us today. Today's session is being recorded and will be available afterwards on the MediKeeper website. We're going to use the Zoom chat functionality for today. You will find the chat at the bottom of the Zoom screen. We're scheduled to run 25 minutes, and we hope to get to all of your questions. But if we miss any, we will come back and address them afterwards. Today's webinar topic is health outcome data from a wellness program. Dr. Tyler Amell, the Chief Health and Strategy Officer at MediKeeper, will be sharing the results of a recent study he conducted. Dr. Amell, judging by today's very large attendance, it looks like we're addressing a topic that has huge interest.
Yes, it certainly does, Daryl. And, this is a topic near and dear to my heart. I've spent a great deal of time throughout my career looking at health outcome data. And it's definitely something that resonates with employers and plan administrators. And lots of folks have an interest in these sort of things because there's questions that a lot of folks have around return on investment and value on investment with regards to investments in the health of their people. And so this is obviously directly related to that. So with that being said, thank you so much for joining us here today. It's always a pleasure. We try and hold these webinars monthly, and we've got a tremendous amount of interest from a lot of folks out there. So definitely something that we like to do. We like to showcase some of our capabilities and some of the solutions, and of course support people from an evidence-informed perspective. Now, as Daryl mentioned, I'm the Chief Health and Strategy Officer at MediKeeper. I do wear a few hats. I apologize, my voice seems to be going. Giving too many webinars these days. I also have a faculty position at Pacific Coast University for Workplace Health Sciences, and I sit on the executive board of the National Wellness Institute as well as the Work Wellness Institute. My contact information is up on the page. Please feel free to reach out to me, send me an email, connect on LinkedIn. I produce a fair bit of original and referenced content when it comes to the relationship between workplace health and productivity, and of course relationships with wellness, well-being, work disability, and all things in between. So one of the things that we like to do in these webinars is to showcase, recent presentations as well as upcoming presentations. So on the screen, we've looked at burnout and what we can do about it back in August. That's available up on the MediKeeper website. We also looked at inclusive health and wellness programming in September. And I did give a talk at HERO in Florida, which is a health enhancement research organization. On diversity, equity, and inclusion, and cultural sensitivity in a large healthcare employer. Now, today, of course, is health outcome data. Coming up next week is a National Wellness Institute webinar looking at forgotten variables when assessing health risk and designing wellness programming. Now, myself as an occupational epidemiologist, I'm a huge fan of using data and information to help guide our practice when it comes to workplace health and productivity solutions. Then coming up in November, just before Thanksgiving, I'll be giving a couple of sessions at the IFEBP National Conference. That's the International Foundation of Employee Benefit Plans. I'll be speaking on mental health and the new work paradigm, as well as a workshop on healthy aging and how employers can help people as they transition into retirement. A lot of people spend a tremendous amount of time and effort saving from a financial perspective to support their retirement, although it seems these days a lot of people are missing those goals, but fewer people actually think about how to invest in their health so that they can actually enjoy those retirement years. So with that being said, we're going to dive into this content. So more than happy to answer any questions. As Daryl mentioned, please use the chat function. When I meet with employers, a lot of them have questions, and this actually came up in a meeting yesterday at the Work Wellness Institute strategy session is around this, what is prevention worth to an employer or plan administrator? Now, we're not going to answer this question here today whatsoever, but these are things that are quite pertinent to organizations with regards to what they're doing to help support the health of their people. And of course, control benefit cost is part of that, but it goes well beyond that. It goes into supporting people in activities in daily living. It goes to supporting people and organizations from recruitment, attraction, retention, which of course is quite important in today's day and age given the labor market. And then there is this concept of disease management and integration for people who are already in a disease state and perhaps looking to control and perhaps improve or reduce the impact of that disease on them. And so that's quite important. Now, from a prevention perspective, obviously, if you're able to steer people in the correct direction right away and reduce the risk of somebody transitioning into a state of illness and all the issues that go along with that, well, of course, that is something of great importance. Now, of course, disease management is that next phase where, let's say, we're not able to prevent a lot of these conditions. We end up whereby we're trying to help people out to better manage. And of course, the workplace has a significant role to play in that, given the fact that, about 50% of insured Americans get their insurance from their employer. And so the employer has a vested interest in these things. And then, of course, there is the opportunity to reverse some of the diseases and issues that are impacting people, and heart disease and type 2 diabetes come to mind. There's a few things that are quite important for people to control their health risk profile as well as their disease risk profile. And there's very compelling evidence these days that type 2 diabetes can actually be reversed. A lot of folks were skeptical earlier on, but there is substantial evidence to show that that is in fact the case, which is wonderful, because the more folks that you can get to control their weight, control their blood sugars, and then through lifestyle factors and a few other things, and get people off metformin and a few things like that, actually do add significant value to your health and well-being strategy. So that's part of the lens in which I use to apply to this particular research study. And this came out from a question from a prospective user of the MetaKeeper platform. Now, I put this up here because there are various different elements to the MetaKeeper solution. And the important part for today's conversation is item number 2, which is the biometrics data, which we use from a couple of different perspectives to add different layers of complexity and utility to the health risk assessment data, or health risk assessment or health risk appraisal data. So examples of these are lipid panels, which we'll talk about today, as well as blood glucose panels that exist in there. And of course, reporting elements tied in with that at the individual level and the organizational level. So essentially, the MetaKeeper platform has a tremendous amount of configurability and flexibility and various disparate elements that all come together to provide a very strong platform on which to guide and deliver a digital health and well-being strategy at the organization level. And so what I did in this particular case was I extracted a large data set, about 110,000 individual employee records, and looked at a sample of some biometric data in there. So this is not something that MetaKeeper has done in the past, but we're going to start doing an awful lot more of this. But I wanted to see what the data were saying, because all things being equal, the data don't lie, and they produce some rather compelling evidence with which to guide your well-being strategy. So 110,000 individuals were included in this particular sample, and I looked at the data over a 5-year period. So this is from 2017 to 2021. And I focused in on a couple of variables. So obviously there's a lot of data in the platform. Some employers and some plan administrators use full functionality. Some use partial functionality. But of course, having the ability to tailor and configure your well-being technology to match your well-being solution, of course, is quite useful for a lot of folks out there. So I focused in on a couple of variables related to heart disease allergies and to diabetes. So I only picked a couple because this is, as I said before, this is the first kick of the can. I wanted to see how useful these data elements were. Surprisingly, really didn't need to clean up very much data because I use lab verified data. So when you combine health risk assessment data, so that's behavioral, that's lifestyle factors based upon self-report, and then you layer in some data from a lab, which is verified data, lab test data, dried blood samples, and a few other modalities on which to capture data elements, then put them in, you can actually get a pretty good comprehensive review as to what the health is of that individual as well as that organization. So these are the elements that I looked at in this particular sample. So BMI, which is body mass index, which is a relationship between your height and weight. And this is an assessment of fat composition. Very, very simple to calculate. And that's one of the reasons why this is used globally as a very simple measure to infer your health status. Now, I also looked at hemoglobin A1C, which is a measure of your blood sugar over the past, let's say, a 3-month window. So this is quite important, especially for looking at people with healthy levels of blood sugar versus those who are in a pre-diabetic state, as well as those who are in a diabetic state. Of course, this is for type 2 diabetes. Now, with high applicability to type 2 diabetes. Now, with this particular measure, this is something that's used the world over. It's a very popular, very, very simple test and extremely useful. Next up are some lipoproteins. So this is high density lipoprotein and low density lipoprotein. So this is cholesterol. So essentially the bad cholesterol, which is low density lipoprotein, and the good cholesterol, which is high density lipoprotein. And then I rounded it out with some data related to weight. Now, to put some qualifying data in place, I actually looked at sex, so females versus males, as well as age groups, which of course, based upon some of the other research that I've done and a lot of other folks have done, when it comes to status and modifiable factors related to your health, having those data in place, as well as, of course, gender and a few other ones as well, race, of course, based upon some of our previous presentations in that space, you get a really good understanding and, of course, can guide your interventions from a health and well-being perspective. So what you're seeing on the screen right here is a summary of the health outcome data on that population of 110,000 users of the MetaKeeper platform spread throughout the age distribution. So of course, we're focused in on people working for the most part, but we do have some folks who are above traditional working years. Now, some folks, of course, are delaying their retirement years. So we may need to develop another category there. So in this case, we have 18 to 34-year-olds. We've got 35 to 49-year-olds, 50 to 64-year-olds, and then 65 years plus by the 5-year period. So that's 2017 full year, 18, 19, 20, and 21 full year. And come the end of 2022, in a short period of time, then I'll redo these data. But you can see that there's a fairly uniform distribution here, which is quite useful and quite helpful. And one of the other pertinent points is we have seen significant increases in utilization and engagement on the MetaKeeper platform during that time period as well. So the numbers are going up. So people are actively engaged in health conversations. And of course, anything employers and plan administrators can do to help support people on that journey will be quite beneficial. So again, there's a lot more data in the data sets than what we're able to produce and report on here. We only have 25 minutes. These are, these can be exceptionally large. And so this is just an example of those few variables that will jump to the top of the list from my perspective. And then over time, what I think we'll do is dive a little bit deeper into the data sets and produce a little bit more examples for individuals looking to develop that business case around that return on investment, value on investment, and of course, improvements in health outcomes is what it is that we're trying to discuss today. So with that being said, this is the body mass index data. Now, this is just for a couple of different populations. So, I'm not reporting, we can get buried in data very, very quickly. Takes a long time to digest the data, analyze the data. These data were analyzed using IBM SPSS, which is a very powerful statistical application. And so basically all I did was I teased out two groups that I thought would be of interest to folks here today. So we've got females aged 35 to 49, and we've got males aged 18 to 34, and broken down over the 5-year period, as well as teased out the last 2 years. So these are the pandemic years, which we know have had significant implications for people's health, primarily from a mental health perspective, but also from a physical health perspective and a total well-being perspective. Folks aren't necessarily in the best state right now. So if we look at the female data, this is interesting. So from 2017 to 2021, we saw a negative 1.11 body mass index overall. So that's moving in the right direction, right? You want to see the BMI down lower, because we know, if you're getting people in, let's say, less than 18 on the BMI, then that's a normal weight. Unfortunately, people are in an obese state or a severely obese state, and our BMI numbers are in the 20s, if not in the 30s in many respects. So anytime you can reverse that BMI ratio, which is a function of height and weight, it's a good thing from my perspective. So when you look at the female data, we're moving in the right direction over the course of the 5 years. But if you look at it over 2020 and 2021, the pandemic years, we did see a slight uptick. So we lost a little ground there. And I did publish some data in the American Journal of Health Promotion, which was related to this as well. Now, if we look at males 18 to 34, you see that they did have a more significant increase, about 2.66% decrease in the BMI over that period. But if you look at over the past 2 years, we're sitting at a 4.19% increase. So, several times that of the loss in the female group in this population. So this is problematic because this is a younger age group. And of course, it takes you a while to turn things around when it comes to making an impact on lifestyles and choices, the things that you eat, the amount of activity that you get. And so this is obviously going in the wrong direction, and not something that should be too much of a surprise, but it's always good to see the data elements there. Now, one thing that I found quite interesting in these data is that even though we did see an increase in the BMI in both the sample populations here, we did actually see positive movement in some of the other variables. So here we're looking at hemoglobin A1C. So again, this is based upon the percentage. So if you've ever had, a blood panel associated with sugars, you'll see this is a percentage in your outcome data. So we're seeing a 1% decrease in females aged 35 to 49 over that period, and a 2% decrease in the pandemic years, 2020 and 2021. Now, very similar results on the male side, 2.83% over the entire period and 2.23% over the near term here. So things are actually looking good from this particular measure. But keep in mind that in order to assess the overall health, you have to look at all disparate aspects of health together and to form a holistic 360-degree view of things. So this is promising, and this is helpful. And of course, this shows how you can capture these data elements, and they can be sensitive to changes in population parameters, especially for a large population like this at 110,000 people. It's a pretty significant number. Now, when it comes to bad cholesterol, so this is low density lipoprotein as measured by milligrams per deciliter. Again, good examples here. So, the weight's moving in the wrong direction. Your height doesn't change, obviously, for adults. And we've known that, we've documented that, but we had positive movement on the hemoglobin A1C, and we're seeing positive movement on the bad cholesterol as well. Almost 4% decrease over the 5-year period in females, and again, 2.4% or so during the pandemic years. Now, on the male side, this was a huge difference, 11% decrease in that 5-year period on the amount of LDL cholesterol, and about 4.26% during the pandemic years. So again, super important, super helpful to have these sort of elements. So we're doing something right here when it comes to correlational research associated with these types of health outcomes during the time frame. Now, of course, those of you who are familiar with this particular space and the role that cholesterol plays in your health, we've got another type of cholesterol that we label as good. And so this one is one that you actually want to see increasing. And so, from this perspective, we saw a slight decrease on the females, about 0.9% over the 5-year period, increase and an increase, further increase at 1.84% during the pandemic years for women. And in males 18 to 34, we see a 0.66% increase during the time frame, as well as from 2020 to 2021. In the pandemic years, we essentially saw a flat line, so negative 0.08%, very low change there from that perspective. Now, finally, body weight, and of course, this is something that's obviously directly related to the BMI ratio that we looked at earlier. Again, not too surprising here for the most part during the 5-year period in that population of females aged 35 to 49, there's a 1.93% increase in body weight. During the pandemic years, a little bit more body weight put on, and again, not too surprising here in that group. Now, on the male side, interestingly, we saw a decrease of 1% in body weight over the 5-year period. So that means that back in 2017, 2018, we actually had a much higher body weight than we saw in this particular sample. But in 2021, during the pandemic, the ratio was significantly higher. So this is definitely moving in the wrong direction at about 5.35%. So again, this is obviously drinking from a fire hose, a tremendous amount of data, lots of information. And of course, this is just examples on how we can use these data elements to drive our wellness programming and understand the health status of our working population. And then, of course, introduce solutions on how to better support people on a health improvement journey. So hopefully you found this of benefit. I had a great time analyzing these data. It's always wonderful to play with large data sets and see what the data tell you. So, quite impressed with this capability so far, and definitely looking forward to doing more of these types of analyses in the near term. And if you have any specific questions, feel free to reach out to me directly or through Daryl. Or if you want to see more of what the MetaKeeper platform can do, absolutely do that as well. But I'd love to be responsive to some of your questions and some of your needs in this respect, because the more people who look at these sort of things, the better off we're all going to be. So it'd be great to get some ideas, perhaps even for future webinars related to health outcomes and other measures that you might be interested in participating with us on. So that being said, I'm going to turn it back over to Daryl, and we'll see if we have any questions. I do realize we're coming up on time. So Daryl, over to you.
Yeah, thank you. Yeah, we are hitting time, and the questions that are coming through are very company specific. So I'm going to hold on those questions and we'll follow up with those companies afterwards. Now, Dr. Amell, I feel like we're probably just scratching the surface in this topic and asking you to cover it in 25 minutes. So perhaps this might be one of the topics we come back and we follow up again. So thank you for your time. It was a great session again today. If you missed any of the other sessions, the other 15 that we've done so far, you'll be able to find them on our website. They are on demand. Thank you for joining us today. This concludes today's session. Thank you again, Dr. Amell.
Thank you all. Have a great day.